thriving businesses, innovative startups, and impactful ventures. Our guests share insights, challenges. Podcast is your go-to resource for motivation and actionable advice. Tune in and transform your passion for care into powerful catalyst for change. Welcome to the Smart Podcast, where healthcare meets hustle. Each week, we bring you inspiring stories from nurses who've turned their clinical expertise into thriving businesses, innovative startups, and impactful ventures. Our guests share insights, challenges, and triumphs of merging compassion with commerce. Whether you're looking to elevate your nursing career or embark on an entrepreneurial journey, the Smart Podcast is your go-to resource for motivation and actionable. Each week, we bring you inspiring stories from nurses who've turned their clinical expertise into thriving businesses, innovative startups, and impactful ventures. Our guests share insights, challenges, and triumphs of merging compassion with commerce. Whether you're looking to elevate your nursing career or embark on an entrepreneurial journey, the Smart Podcast is your go-to resource for motivation and actionable advice. Tune in and transform your passion for care into powerful catalyst for change.
Welcome to our Smart Podcast, and we're excited to have you watching us, of course, on our first episode of the Smart Podcast. We are excited to, of course, have our esteemed guest, Professor Loniah Mwape, to join us on a brief, deep conversation where we dive into the professional life, personal life, and of course, academic life. Professor Mwape, thank you very much for joining us and welcome to the Smart Podcast.
Thank you very much. I'm very, very grateful to have this opportunity to come and speak to the nurses that will be able to listen to this podcast and those that are planning to join the profession.
Thank you very much, and they're excited, of course, to watch you here on the Smart Podcast as we host you. And of course, without a doubt, Professor, many of our nurses and the audience will appreciate from this podcast. Now, to start with, because we also want to understand and to know you a bit better, let's pick it up from knowing who Professor Loniah Mwape is. Who is she? How did she grow up? What kind of childhood did she experience?
Thank you. Thank you very much. So like you have rightly put it, my name's Loniah Mwape. I grew up from a very humble background. I was born and bred in Ndola. Those of you that have taken the route to the Copper Belt through Ndola to Kitwe will know where Twapia is located. I call it my village because that's what made me who I am today. So I grew up from there. I went to primary school from grade 1 to grade 5 at Mabungo Primary School within Twapia. Later on, my parents decided that I needed to go to the rural area just to ensure that I completed my primary school. So I was sent to a primary school along Ndola Kapiri Road called Kashito Primary School, where one of my first cousins worked as a teacher. So I did my grade 6 there and my grade 7 and qualified to go to secondary school. And I was at full secondary school from Form 1 up to Form 4 first term when I decided to go into boarding and ended up at Maple Shore Girls Secondary School in Ndereshi. So I'm a proud Ndereshi girl.
Okay, that's your experience of that boarding school arrangement. How was it?
Well, I grew up with my parents and around my family from grade 1 up to the time that I moved now to go into boarding. I was excited to go into boarding, but settling down at that time was very difficult because I was just learning not to depend entirely on my parents and that I could begin to manage my life on my own. But although the beginning was difficult, it actually ended up being a very, very enriching experience where I began to learn my independence. to learn how to behave, to learn what to avoid and what to risk in terms of experiencing. So it kind of created the foundation on which I built the life that I'm leading today.
Okay, that's really interesting. So, tell us something. What did your academic journey look like after completing ritual?
So then when I completed grade 12 at Nebosho Girl, as you are in grade 12, then you start kind of, discussing and arguing, or rather discovering exactly what you want to be after grade 12. It's surprising that the first thing that I wanted to do, not knowing the career opportunities, was to be a fashion designer. But with my dressing is actually ordinary. So this time round, I wonder whether I would have made it as a fashion designer. So I thought about fashion designing, but when I researched further, I realized that there were very few opportunities, if any, at the time to thrive in fashion designing. And then I thought, well, I think I'll be a registered nurse.
Okay.
And so it was in my mind when I was completing grade 12 that I needed to do registered nursing. And, for some of us that grew up in humble backgrounds, we didn't have connections, we didn't have, appropriate or correct information about certain trainings, how you can get there. So it took my uncle, who lived in Makeni, may he so rest in peace, to contact my mother in Twapia that I needed to travel to Lusaka for interviews. And those interviews took place at Evelyn Hall College. And in those interviews, it wasn't only nurses that were being interviewed. So it was all health workers. And you chose what you wanted to be. So, I looked at my results and I thought, we're talking, all of us that were interested in doing nursing got to talk. And so I ended up thinking, oh no, I think on this form, I'll start as an enrolled nurse, because I didn't even know that you could go directly into registered nursing. So I completed the form and I wanted to be an enrolled nurse. And then later on, I would upgrade to registered nursing. So I completed that form. And on the form, I indicated that I wanted to be an enrolled nurse. And following our discussions, we all thought that you could only start from enrolled nursing and then upgrade after you have qualified. And so when time came for me to go in for the face-to-face interview, the interviewers looked at me, interviewed me, asked me what motivated me to become a nurse. And I explained everything. And at the end of the interview, they asked me, looking at your results, we think that you can go into registered nursing instead of enrolled nursing.
As a difference.
Are you interested? So the difference at that particular time was that for enrolled nursing programs, you only did 2 years. And the registered nursing, you did 3 years. So even when it came to working, the registered nurse was the supervisor of an enrolled nurse. In those years, but even now, you could still see some of the enrolled nurses wearing a cape with a blue line in the cape. So those are enrolled nurses. That program was abolished in 2019. So we stopped training enrolled nurses in 2019. And so that's how I got onto the registered nursing program. And next thing, I received an acceptance letter, and it was University Teaching Hospital's Saka School of Nursing. So wow. And so that's how I started my nursing. Because I came from a boarding school, I already had very good study skills. And so when I got into the registered nursing program, I wouldn't say that it was difficult for me to cope with the program. The first 6 months is very critical. And at that time, that group of students came from everywhere. Some of us were interviewed at Evelyn Horn, others were interviewed from other provinces. And so we met as a cohort with different backgrounds. And some of who didn't know the amount of study time they needed to allocate to the work or to the studies. And so there were 65 of us in that class. So we filled the UTH lecture theatre, that lecture theatre. But after 6 months, we had a third of us drop out because they couldn't manage to pass the number of courses that they needed to pass to progress to the next 6 months. Out of the 60 that we were, 5 of us, 5 including myself, cleared all the courses. Where we had one of the lecturers line the 5 of us up. So the 5 of us, 3 of us were actually studying together. And, like shows everybody now in class, you see these 5? These 5 are the ones that know why they are here. So, we got so motivated. And when we are getting results, like when we write tests and we are getting results, so we would get results I would get results for my friends, and we stayed in the same hostels. So when they've heard that we are getting results and I am, one of us is getting the results for everyone. So when you are running now into the hostels with results, then they'll ask you, what's happening there? Then you're going, say, we get it. Yeah. So, meaning that we studied really hard. During the time that I was at the School of Nursing, I learned that you actually could study and sleep for 5 minutes when you're tired and wake up fresh. So we worked really hard, and setting through the program was like, as smooth as everyone would like it to be, because we put in quite a lot. When we expect exams, we hardly ever had any social life until the exams were done. So that was the School of Nursing. And after graduating, then everybody wanted to be a midwife. But during my training, I got interested in mental health nursing, and I thought, well, I wanted to be a mental health nurse. So while I was working, I received 2 admissions into the midwifery school, but I declined to go. But luckily enough, there was an introduction of the registered mental health nursing program at Chainama College. And when I heard about it, I had to go. So I was in the second group, and there I graduated as best student all round because that's what I wanted to do. And because I graduated as best student all round, after having worked for a few years, I was invited by the college site to be the clinical instructor, one of the clinical instructors for those that were training as registered mental health nurses. And so I was a clinical instructor for a couple of years, and through funding from WHO, I got a scholarship.
So there was a part of where you said a lot of students like men or more done with school wanted to do midwifery. And then we were offered 2 admissions, for which I know everyone has to be excited when they offered admission in SC. And you declined them because you wanted to do mental health. So what motivated you to do registered mental health?
The exposure that I had during my registered nursing training at Chainama Hills Hospital. Normally the program at that time had gave us 6 weeks exposure in terms of practice, where you are located to Chainama Hills Hospital. And during that time, I found myself feeling at home and kind of understood what the patients were going through. And I thought that, or I should say that in itself the interaction with the students, interaction with the patients and interaction with the members of staff there kind of triggered something in me that confirmed within myself that that's the place that I wanted to be.
So weren't you at any points not scared because, you're dealing with people that are mentally not stable? Why you feel they can beat you, they are violent and everything?
I think that I was born a mental health nurse because nothing that happened on the wards, even before I actually trained as a mental health nurse, really scared me to pursue mental health nursing. So in a way, I think that I think God made it that I should be a mental health nurse.
That's really
Quite very interesting. And I think the war is progression in terms of your career. And we just also want to find out, maybe you can pick it up from where you left earlier on how it was for you in trying to accept these offers and just braving the odds of wanting to go the other route of what you believe in. How has it been for you? And what has made you, what has kept you going? What has kept you wanting to even attain more educational qualifications, even up to reaching the PhD level when we are seated next to, from just being Miss to Mrs. and now a professor?
Yeah, so even the time that I started training and getting to know the ladder or the academic progression of nursing and midwifery, what I didn't want was to remain a registered nurse working on the wards. When I went to train at Lusaka College of Nursing, I looked up to our tutors and always felt like I wanted to be like them when I grow up. I would see them delivering the content in front of us in the different, classes and courses that I took, and always felt that that's what I needed to do. I didn't want to remain working as a registered nurse without progressing academically. And so at that point, I knew the progression, the academic progression. I knew that in nursing, you could do a bachelor's degree, you could to go through to a master's degree, and you actually could also go through to have a PhD. And so I really was looking forward to taking steps, moving up academically, which I also thought that would mean that I'm moving up professionally as well. Yeah.
Okay, quite an interesting. And maybe just run us through that academic journey. Where did you start? Where did you get those qualifications? How easy was it?
It wasn't that easy because at the time, after graduating from Chainama College of Health Sciences as a registered mental health nurse, there wasn't any higher institution of learning in Zambia that would offer a bachelor's degree in mental health nursing. And so all of us that wanted bachelor's degrees at that time were looking up to the post-basic department at the University of Zambia, which now we call the School of Nursing Sciences, where I'm working and where I'm serving as acting dean at the minute. So I did apply to go to the post-basic School of Nursing to pursue my bachelor's degree. And while waiting for an acceptance letter, I won a scholarship through Ministry of Health and WHO to go to Scotland and pursue something that was associated to mental health. So after I had left, actually, that's when I realized that there was an acceptance letter to come to University of Zambia. But I was already in Scotland, and Ministry of Health at that time, through personnel office, assisted in looking for scholarships that were being offered within mental health, because at that time it was the Ministry of Health realized that we didn't have enough personnel in mental health nursing around that level of training. So the next WHO scholarship that came was given to myself and another friend of mine to go to Scotland at the Glasgow Caledonian University to do a bachelor's degree program. But what happened there was because their training programs are modular, and depending on the number of modules that you take, each module attracts credits. And the number of credits that you accumulate at one point are the ones that will steer you up to the bachelor's degree if you want. So both myself, my friend and I managed to finish the bachelor's degree program modules within 1 year, and yet WHO sponsored us for 2 years. So we still had 1 year sponsorship. And I mean, there's no way that we would have come back home because we've been given a bachelor's degree knowing that we still are sponsored for the next year. And so in the UK also, the master's degree programs run for 9 months actually. 6 months in class, the remaining 6 months, to make a year, past 9 months for you to do the dissertation. So we requested whether we could progress onto the master's program, and we were allowed because we had funding. So that's how we went in for the bachelor's degree. But when we were coming back, we had both the bachelor's degree and the master's. That was so that's how.
So it's very interesting because you go for one and then you come back with two. So you killed
two birds with one stone.
So what would you say were your major challenges during your school, from the way you moved each year till you went to do your master's and then till you came back?
Some of the challenges, especially the times that I went to study in the UK for the bachelor's and NSC program, was just, the education system that I went through here was kind of different from what I found in the UK. And so the first semester was really hard for me to adjust. I remember that I think because of also misunderstanding the presentation of the courses, the first semester I actually failed one course. And during the time that I was at the Lusaka School of Nursing, now Lusaka College of Nursing at Chainama College of Health Sciences, I never failed any course. And so that just threw me off balance. I was almost like getting depressed, failing. So anyway, I had to retake that course because the lecturers there are very open. They explained to me why I failed and where, I misunderstood issues. And so it meant that in the next semester, I had to take an overload, including the course that I failed. And so after the first semester, then I had settled, down in terms of navigating the university, navigating the libraries. At that point, they were more online than we were, so I had to, keep up with all that. But getting into the second semester, I think I was getting to grips with what was in front of me, and so I managed to clear all the 4 courses and awarded the bachelor's degree and then moved on to the MSc. But considering the challenges that I experienced at bachelor's degree, I can tell you one thing, that the master's degree was like a sell-through. So that even when it came to graduating at master's degree level, I graduated with a distinction. Because now I had stabilized and I knew how to navigate the university.
Okay. But how easy is it now for young nurses who want to pursue other avenues within their profession? How easy is it? Is it the same as it was back then when you were starting? what other opportunities are there for these young nurses who want to go study abroad, advance into attaining a bachelor's from just being a registered nurse, a diploma to a bachelor's, master's? How easy is it that?
I would say it's not as easy as it was in our time, because if you look at current times, we have an increase in the numbers of training institutions offloading nurses and midwives. And what that means is we are graduating more nurses at a time than we used to graduate those years. So opportunities would be there, but they wouldn't be as available or as accessible as they were previously. But then the other positive thing that I need to make mention here is that when a student or when a graduate is good, they are good. And, for as long as you have done very well and you are recognized for having passed very well, the opportunities for you are actually more than somebody who hasn't performed as well as you have done. So there are still opportunities, especially, I should say, especially for the cream de la cream of the nurses and midwives that are being churned out of the training institutions.
Interesting. So back from getting a master's, a professor, you were there working in the profession. You are back. You're now an academician. Where was the transition? How did the transition happen?
So I came back from the UK with two qualifications instead of one. And I went back to China College to work. So I arrived there and started working as a lecturer. And as time was moving, I started moving through the ranks. The first time I was recognized was when I was given the position of Dean of Students. So then I was responsible for students affairs at Chainama College of Health Sciences. I must mention that I worked very well with the student union and with the students as well. Some of whom are old now and are working, and I meet them, we joke about the life at Chainama. And I remember that there was a time that I was out in South Africa attending some workshop. And when I arrived back, at the time I was a Dean of Students, I found that there was a strike. The students were striking, and I found things had escalated to a level where we actually had to seek permission from the Ministry of Health to close the college. And I remember that when I arrived back, my supervisor was the executive director at Chainama Hughes College Hospital, actually confronting me and telling me that if you were around, this situation wouldn't have escalated to where it is now. So, those points made me realize that there was something positive that I was contributing in the lives of students, and students respected my opinions. I respected their position as students as well, and so we worked together very well, and my supervisors know that. So after that, then I moved into the office of the registrar. So as a registrar for the college, the first nurse to serve as registrar at Chainama College of Health Sciences, because we were not the only ones that were being trained there. And subsequently, the first nurse to take up the position of director training. At the time, the director training went for his studies. And so before then, he came back for his studies from South Africa. It was also time for me to go back for my PhD. So that's how I did China as director training.
Okay. Can I show your journey of you are going to attend your PhD, professor? Where was the motivation? Did you think at the time maybe a master's was enough?
I remember I arrived at the Chainama College of Health Sciences and as a clinical instructor, if I take you back a bit, and I was given an office which I shared with two other colleagues. unfortunately, both of them have since died. So there were two females, myself and another colleague who was actually senior by age and also professionally, and a colleague who was a clinical officer psychiatry who has also since passed. May their souls rest in peace. And so when I arrived there, this male colleague asked me, "So Loni, so you've come here as a clinical instructor. Where are you seeing yourself in the next 5 years?" At that point, I only had my diploma as a registered nurse and a diploma in registered mental health nursing. And so I looked at him and I said, "I want to do a bachelor's degree, and then I want to do a master's degree, and then I want to do a PhD." And I burst out to laugh at myself. So he says, "No, don't laugh. That's very serious. You need to just focus." So, we joked about it and we laughed. At that particular time, him was doing a bachelor's in I think adult education or something at the University of Zambia. I hadn't started. And so when I got the scholarship to go to Scotland, by the time I was coming back, he was finishing his distance education bachelor's degree, and I had come back with a master's degree on top of a PhD. So I was joking with him saying, "You see, in my language, we started earlier, but here are my qualifications." We used to motivate each other like that. But apparently, even for him, by the time he was dying a couple of years ago, he already had a PhD. So, having a PhD was something that I thought about and I hoped for and I worked towards from the time that I stepped on the soil of the Kusaka College of Nursing, when I realized that there was there was an academic ladder that you can aspire through as a nurse. And that even in nursing, you can have a doctor in nursing. And so I had to leave the office of the director training at Chainama to go and do my PhD. At that particular time, I didn't have actually any specific funding. Chainama College bought me an air ticket and paid 25% of my fees. And I thought because I was a registered nurse, I would be working part-time in the UK and paying my fees. So when I arrived there with 25% tuition fees from Chainama College of Health Sciences, I also negotiated within the department and asked for another 25% waiver because of the background I was coming from and that I didn't have somebody to fund my studies. And fortunately, the dean of the faculty at that time gave me the 25%. So it meant that I only had 50% to pay for myself. And so that's how I worked. I actually worked in the UK and studied. And then at some point, you in life, you reach a stage or you reach an age where home is home. And regardless of what it is, that's where you belong. You miss certain things at home. You miss things like during the rainy season, I want to go to the market and buy masuku at it. I won't find any masuku in the UK. It's summertime. It's a bit warmer and you're seated outside sunbasking alone and the family is back home. So I did the first 2 years of my PhD full-time and I couldn't manage to cope to stay. I needed to come back home because I was missing home a lot. So I requested whether I could do the last 1 year through distance because I had finished all the classes that I needed to attend and had started packaging my PhD thesis. And so I was allowed to come back. That's how I came back to Chainama College of Health Sciences and worked until the time that the University of Zambia advertised for a lecturer in mental health nursing. And you know that generally mental health nursing is stigmatizing. people think that because I've done mental health nursing, I'm also mental health learner. And so I ride on the stigma to progress to where I am now. And so there's not much competition. So there were just 2 of us that would compete for that position at the University of Zambia. And I happens to be the one to get it. And that's how come I'm still with the University of Zambia. So I had moved to the University of Zambia, and the first year at the university, while working, I completed my PhD and graduated in 2020.
Such a long time, 15 years down the line. Okay, no, congratulations. All right, once more. Okay, just briefly run us through how easy is it for nurses who are working now to have these similar opportunities you had going to pursue higher education, even in the UK or other places, even working there? How is it for these young professions now?
I'll start by going to school, which I referred to earlier on, that when you're good, you're good. When people appreciate that academically you're committed, you're hardworking, you are a high flyer, opportunities are available. People will identify you and people will connect you to the opportunities that you deserve to have. And so even if the opportunities are not as many as they used to be in the past, but they have opportunities that people can compete, for. And now coming to the issues of going to the UK to work, it's not only the UK. I think within the time that I have been a nurse and in administration and an academician, I've seen a lot of nurses migrate from this country to go and work. Some work in the UK, work in the US, work in Australia. It's a global village. And when opportunities are open, sometimes it's difficult for you to prevent people from going. So allow the ones that want to go. Some of us that think we want to be here, we remain. But that doesn't mean that the people that have left to go and work somewhere else are not we are not I don't want to say law abiding, and not, they're still citizens of his country, and indirectly they are bringing revenue by sending money back to their country, to their family. That in itself also helps to develop the country. But you'll find that even when floodgates are open for whoever wants to go and work abroad, whoever wants to go and work abroad to go, there will still be people that would want to remain home. Others have gone to work, they've worked for a short period of time and they have come back because this is where they want to be. Those that want to remain out there, they still can remain out there, but they are still Zambians, they are still our brothers and sisters, and we still love them.
And where does one get those opportunities? Where they found? In case one wants to.
In case one wants.
Well, I'm actually not sure because I don't look through right now, but I want to believe that, with the opening up of internet, where everything is online, people search for things that sometimes when they bring to you, you think, wow, how did you even find this? It was found online. So people are getting connected online. There are people out there who, when they see opportunities available, they'll contact their friends here, and their friends here will share with other friends, and and they go. So opportunities are still there, and they're on the phone, let's say. Helpful.
This my friend.
For you, what advice would you give for studies out there or a nurse who's already qualified as well as the ones who are awaiting deployment? What advice would you give them because they're looking at opportunities and what else they can do aside from nursing or within the nursing fraternity? What aligns for them in future?
I'll tell you one thing that nursing is a very demanding profession. I have a lot of times said that it's not for the faint-hearted, but it's a very enriching profession. If that's a profession you chose, you will enjoy working in it. But if you came in this profession because that's all you could manage to find, you might find it difficult to cope. When I'm speaking to students and I'm speaking to my fellow nurses, I ask them how they feel when they go in the ward and they find a patient in a mess on the bed. They bath that patient. If they are diapers, change the patient's diapers. The bed where you went smelling feces and urine, and you are walking away from that bed and it's smelling talcum powder. I ask them, how do you feel? If you don't feel anything, then you don't belong here. For me, when I'm bathing a patient who is covered in feces and in urine, and I'm walking away, I don't even care how much I'm getting. The gratification that I get from helping this person in a vulnerable situation is much more than the money that I get. And so, if you don't feel touched by that, then you are in a totally wrong profession. We don't join nursing for money. We join nursing because of the sanctity of, the sanctity of the profession. People come to you at the time they are most vulnerable. And they come to you because they trust that you will help them. And if you want to start yelling at them or kicking them left, right, and center, I say you are in a totally wrong profession. You need to get out and go and look for where you belong. We are in nursing because we have a heart to care. We are in nursing because we want to respect every patient that arrives at our care. That the person that's arriving to you in tattered trousers and dresses and chitenges is as human as you are, you who had the bath in the morning. When you receive them, you might not even know how much they have done for this country to be where it is today. But because they are old and they are tattered, then you start kicking them around and yelling at them, you are in a totally wrong profession. I urge everyone who doesn't feel connected to the patients that arrive at their care to find a profession where they belong. I know that we talk about the profession being in battles, the profession's image being embattled. There are very good nurses out there. They're just a few nuts that are tarnishing the age of the profession. I am in nursing because I chose to be a nurse. I love to be a nurse. I am proud to be a nurse. And I always call upon everyone to join hands and celebrate the uniqueness of this profession. We are not in it for money. We are in it because we care. We are in it because we have to be there to care for people that arrive in our hands in their most vulnerable time.
No, Professor, just before we conclude now, does it mean for those ones who are in school, you had mentioned at one point pursuing higher education or so, wanting to even get more qualifications, you fell off with one subject, but you soldiered on. What would you tell such a one in school there Now, just because they have failed and then they're thinking maybe this is not what my passion, or maybe they want to give up on the profession.
I'll give you an example of one of my students that I'm supervising in research, and I'm sure that when you post this podcast, he might even be able to listen to it and might identify himself with what I'm talking about now. So he says, "No, Prof, I feel like giving up because when I send documents, they are coming back. There are a lot of comments and seems that I'm not making any progress." And I said, "I understand what you mean, but you have come this far. You have done so much so far, and you want to give it up now? No." And in addition, in academia, even nursing training is part of academics. In academia, if you are not you're not coming across any challenges or anything that you struggle to do, but anyhow, you work hard and you manage to do it, then it's a fluke. If you think you're just going to sail through and think it's going to be as easy as drinking water, it isn't. It takes time, effort, and commitment. Without that, yes, you can decide to leave. But even if you leave wherever you will go, if it's a genuine qualification you are looking for, it doesn't come on a silver platter. I tell my students, if these degrees that we are giving you here at the University of Zambia were easy to get, every Jim and Jack that you see walking along the street there will have them.
And because society says degrees is so can you pass through with you get one?
Yes, pass through Unza will give you one.
Let's get that paper.
Yes. But even when you get the paper doesn't mean anything. The paper means something if you can show people that you went to do a bachelor's degree and you have come back and you have changed personally the way that you do things. So it is all in what you are able to do. Otherwise, it won't make any difference. You can have a PhD, but if you are still in the way that you do things, in the way that you interact with your patient, in the way that you interact with your students, if you are still behaving the way you were behaving when you got a diploma, a PhD doesn't mean anything. So it lies in the way, in what you have to offload to the community. Should it be the academic community, the research community, the community where we live? If you are making a difference there, then your paper makes a difference.
And Professor, thank you very much for well elaborating those quality points and for your now extensive experience from academia. And of course, you've traveled across different countries just trying to see how the profession operates. What do you think our Zambian nursing profession needs to improve for it to continue producing a quality and competent nurses, so that whenever patients visit these healthcare facilities, they appreciate this kind of service?
I think on that one, what I would say is competence space begins at individual level. Yourself as an individual who's gone into train, how committed are you to the training program? We need to introspect at individual level and agree that this is where I want to be. And as long as you agree with yourself that this is where you want to be, even when you meet challenges are part of life in academia. Even if you meet challenges, you'll be able to work through the challenges and achieve what it is that you want to achieve. In our training programs, some competencies that we make sure that our students graduate with include the fact that we give them we help them to acquire the knowledge. We also need them to acquire the skills. they need to go and make sure that when they're giving an injection, they're giving it on the right site at the right time, and they make sure they're giving the correct medication. But we also teach them the issues of attitude. And when you take all the three together, a nurse who has knowledge, a nurse who has skills, a nurse who has positive attitudes, then you have a nurse that can deliver quality nursing care to the patients. With the three, you have a nurse who won't be screaming at a patient. In my own opinion, like I mentioned earlier, a nurse can acquire knowledge and skills, but if they don't change the attitude to fit the profession within which they will be operating, then we have the problem right there. Not paying attention to things that are supposed to be done on the patient. They don't care whether the patient should receive medication at this particular time. They don't care about anything. It is an issue of attitude, which also begins from an individual. And sometimes individuals find themselves in nursing not because they wanted to be there, and because that's not where they wanted to be. It connects with the way they behave toward the patients and towards their relatives, towards the patient's relatives, even toward their superiors at the workplace. So it starts on individual level. In terms of training, we make sure that we give them all the skills. But it's up to you to take some of the skills and lead them. And that's how you see within one class, you have 3/4 of the graduates, very good, very committed, and you have 1/4 of them who really don't give it a damn. It's unfortunate. And those are the ones to whom I'm appealing for them to go and find where they belong, so that they don't unleash their frustrations on patients that arrive at their in their hands at their most vulnerable time.
That's interesting, Prof. Now, from you as an academician, how important is it that nurses, while training, have a kind of an entrepreneur mind? How do you think that is important, especially in the time we are living in, for them not to they should maybe pay just so much attention to their profession, or they should see how best they can also just try to diversify in terms of wanting to sustain or manage the living?
Yeah. The beauty about the current nursing training is we have a component of entrepreneurship in the curriculum, because we realize that as a number of nurses being produced in training institutions is increasing, it's not possible that government can absorb everyone. And for me, it's also unfortunate that all the time we are appealing to government. Can government absorb everyone? No, but it shouldn't be like that. It shouldn't be government to absorb every person that we are training. There should be other opportunities where nurses that have graduated, should go and increment their skills. The current Nurses and Midwives Act actually provide a lot of opportunities for nurses in terms of entrepreneurship. Just like our colleagues in other professions, people are grouping up to open up something, for as long as we know that that's being done in the confines and the prescriptions of the law. There are lots of opportunities within the Nurses and Midwives, the current Nurses and Midwives Act. People can set up nursing homes, for instance. People can set up health facilities where, for instance, people can just walk in and have their BP checked, their temperature checked, and if the BP is high, the nurse can refer them, for further interventions. So there are a lot of opportunities in there, and I think it's important for us not to expect that government should absorb everyone that's being churned out of the training institutions. We need also within our profession to create opportunities within ourselves. Like, opening up nursing homes, opening up other facilities that are provided for within the law. And so that instead of waiting for government to employ us, we also help government to employ others and contribute to the development of this country. So the opportunities for entrepreneurship are actually even within the curricula of nursing can be
Yeah, when it comes to opening up to these nursing homes and everything, can a nurse also open up a nursing school? Because I think most of these schools, you find that they've been opened up by doctors. And I don't know if nurses don't know about that part or it has not yet been opened up to us.
But how can it not be opened up to them? Because the Nurses and Midwives Act is theirs. It's our year. So how can we not know that within the law that within the Nurses and Midwives Act, which is our act, which regulates us, we are the owners. How can we not know that as a nurse I can open a school of nursing? The reason why that was done was for nurses. Actually, was to open up nurses to entrepreneurship. But we allow others.
Or we say our minds are set towards what to be employed to some.
Employed by government, especially.
I think most nurses are put on the far word. They can open up a nursing school. Yes, this will be an eye-opener for most nurses and be able to do other things. Just wait for government to deploy.
Yes, not wait for government to deploy. Let's also help government to create more opportunities for nurses to be employed.
And as we conclude, Professor, your concluding words.
My concluding words, something that I tell myself I would be failing myself and the profession if I don't say it. And I think I have mentioned it at several points, that nursing is very demanding, yet very enriching for somebody that wanted to be in this profession. And that we have a responsibility to take care of patients, regardless of their background, regardless of the condition in which they arrive in our care. Because we don't know how much they even contributed to the development of this country before they became ill. We receive them at their most vulnerable, and so we have the responsibility to respect them and to provide them with the care that they deserve. We want to celebrate the uniqueness of this profession from the sanctity aspect of it. And that, yes, we need money to sustain ourselves, but if we advance the issue of money, we will not be able to provide the care. We are here because we care, and the care that we should be providing to our patients should be seen. We need to respect our patients. We need to be committed to our profession and to our work. And we also need to introspect within ourselves. And if we find that this isn't where we belong, we need to get out of here as soon as possible. Because otherwise, we'll be killing people in our care. We need nurses that are committed to the profession. And if a nurse chose to be here, we won't be complaining about their commitment and about how they treat patients and about how they sulk when they are interacting with their fellow nurses. We are here to care, and it should show that we are caring. If we don't feel that, it's time for us to get out. Thank you very much.
Thank you very much, Professor. Quite an interesting discussion we've had with Professor Loniah Mwape, who is an academician and, of course, seasoned nurse. And, of course, commitment, focus, and hard work are the key words that have been highlighted and as part of this discussion we've had. Quite interesting. And we hope you, our dear nurses, our dear audience, will benefit from such conversations, and we wish you all the best in your young careers. So thank you very much for watching. Until next time.